Okay, so the first one that I'm going to show you is for the mid to low trap. I like to use a lacrosse ball. You can use a tennis ball or anything small. You know, foam roller isn't going to work because it's too broad for the shoulder muscles. So anything small like this will be fine. So you want to aim for this area between the spine and the scapula here. So right between there, you just kind of place the ball there and then lean against the wall. I like to take my opposite arm and just hold this arm. That way you're not having to engage the muscles behind the scapula. You can kind of move up and down to find some taut fibers, and you're gonna know you're there because it's gonna be a little uncomfortable. It should be like a good hurt though. So on a scale of 1 to 10, this is probably it's probably a 3 right here for me, maybe a 4. So that's about as high as you want to go. You don't want this to be super painful. So it still feels more good than bad. Okay, so I'm just gonna kind of hold that, and if I wanted more pressure, I could just simply step my feet out a little bit more to give myself a little more pressure there if I wasn't at that 4 to 10 already. So with this, you just kind of want to, and again, you can move up and down if you haven't found the fibers. Just kind of roll up or down to find some of those, 4 out of 10, pain levels. So you want to kind of hold that, take a deep breath in, and just sort of let your body settle into it. Sometimes you will feel a referral coming out to the arm here, and that's okay. That's a referral for trigger points in the trap. And then you'll also occasionally feel it coming around the ear, and even into the jaw in some cases. Those are all good signs, or signs that you're in the right, you're on the right fibers, because that's where that's the low trap referring to the high trap when it's coming around your ear like that. So you want to hold that for about 30 seconds or so. You can find another top fiber and kind of, go from there. So, just stay on one top fiber for about 30 seconds and move on. Do a few deep breaths and then go to the next fiber. So, I could kind of hold it here, then I could roll up, see if I can find another one, same thing, take a few deep breaths. Good. And again, holding your arm so that the scapula isn't having to, or the trap isn't having to stabilize the scapula. So yeah, and I'm getting some referral coming around this way. So I realize that this isn't necessarily part of the rotator cuff, but you can't get full glenohumeral movement unless you have a stable scapula. So it has to start here. So this is one of the first videos that I wanted to show you for that reason. And then I'm gonna probably send you about 5 more. So start with that.